Okay, so I'll take you through these beta-lactam and other cell wall and membrane active antibiotics. Okay, so has anybody heard about beta-lactam antibiotics? Anybody? Have you heard about these beta-lactam antibiotics?
We've heard of them, doctor, but we haven't had any more contact with them other than just hearing their names.
Okay. All right. I'll take you through. Okay, so by the end of the session, you should be able to classify beta-lactam compounds, describe the structure of penicillins in this particular regard, but there are other beta-lactam compounds we look at. You should be able also to outline the groups of penicillins. Outlining these groups is important because it will help you select the right drugs to use for specific or particular infections or suspected causes of infection. You should be able to list the drugs in the different groups of the penicillins. You should be able to explain the bacterial cell wall synthesis, the mechanism of action of penicillins, and then also to explain the resistance that occurs against the penicillins. Now, the beta-lactam compounds are the following. One, we do have penicillins, we have cephalosporins, monobactams, carbapenems, and beta-lactamase inhibitors. Now, since it's good, when we go through these particular drugs, you'll understand what beta-lactamase inhibitors really are. But we are going to go through the penicillins for now. Now, the penicillins, this is the structure. They do have substituents that differentiate them one from another, but in general, this is the structure of the beta-lactam antibiotics. So they do, the penicillins, they do have this ring, okay? And then they do have the B ring here, which is referred to as the beta-lactam ring. It's a four-membered ring, and this is what it basically looks like. And all beta-lactam antibiotics have this ring, okay? And then the penicillins do have substituents R, and those substituents differ one from another, and therefore you do have different penicillins. And also they do have different effects on different organisms. This is why it is important to learn what these beta-lactam antibiotics are and which organisms they should be able to act against and which ones you can't use them against. Okay, so there are two enzymes here. There is the amidase. The amidase enzyme is the one that breaks off the substituent. Now, this substituent is the one that does contain the structure R that gives some effect and different effects to the penicillin structure. And then we do have the enzyme penicillinase, which breaks down the beta-lactam ring, this ring, and therefore renders the penicillin ineffective. And so this enzyme is critical, okay? And this is the chemistry of the penicillins. So the site of action of penicillinases, okay, penicillinases, these are also referred to as beta-lactamases because they break down the beta-lactam ring is right there. and then the site which is number 1 right here, and the site of action of the amidase is here, number 2. And then we have the thiazolidine ring and the beta-lactam ring. Okay, now I did include this particular table because knowledge of this is critical. But I do believe you have done microbiology, yes? Yes or no?
Yes, sir.
Okay.
Yes, sir.
Okay, so that means that you're familiar with these organisms. Now, the ones I would like to look at basically are the bacteria. Okay, we do have the aerobic. This is consider this an overview, and aerobic organisms and the anaerobic organisms. Now, under these, we do have the gram-positive and gram-negative organisms. And that also applies to the anaerobic ones, gram-positive and gram-negative organisms. And of course, further subdivision, we do have cocci and the rods under the gram-positive aerobic organisms, and the same applies the same applies to the gram-negative. We have cocci and we do have the rods, okay, which are also referred to as bacilli. Now, under the anaerobic organisms, we do have under gram-positive, we have cocci and we have rods. While under the gram-negative, we do not have any cocci that are anaerobic, but we do have anaerobic rods. I believe this you have already studied, and so this is just an overview. But this overview is critical. It is important. Okay. Now, of course, the gram-positive cocci, these are common. We have streptococci pneumoniae, pneumococcus, viridans, streptococci, and group A streptococci, the enterococci, staphylococci, and the others. And then the rods, which are gram-positive, we have Corynebacterium and Listeria. Under the gram-negative cocci, we have Moraxella and then Neisseria. It's important to remember these. And then the rods, which are the usual rods, Enterobacteria, say Escherichia coli, Klebsiella, Enterobacter, Citrobacter, Protea, Serratia, Salmonella, Shigella, and the others. And then Campylobacter, Pseudomonas, Helicobacter, Haemophilus, Legionella. Now, you can always, read and refer to the others. Now, this is important. Why is it important? Because what we are studying now is, even though we have basic pharmacology, I would like it to bend more to the clinical pharmacology so that you will easily apply these drugs when managing particular conditions. But you need to know the organisms and to know the common organisms for specific conditions. For now, I'm going to look at acute sinusitis just for you to look at the organisms involved, and then we'll look at pneumonia. But this table will be good for you to revise. So for acute sinusitis, we have causes. We have Streptococcus pneumoniae. I'm dealing with the bacteria. We have Haemophilus influenzae and Moraxella catarrhalis. And you'll find the same organisms causing bronchitis, the one right above acute sinusitis. Now, when it comes to pneumonia, and I will look only at community-acquired pneumonia, and particularly I will look at the normal host and the pediatric patient. Now, the normal host, the adult, is this condition is caused by Streptococcus pneumoniae and by Mycoplasma. Ignore other viruses, okay? Mycoplasma. Now that you have studied antibiotics, you can tell me what type of organism a Mycoplasma is. Somebody? Mycoplasma?
Doctor,
Yes?
is it a fungus?
No. It's not a fungus. Somebody else? Okay, maybe your memory is skipping you. It's a bacteria.
Doctor?
Yes.
Yeah, doctor, it's a bacteria that doesn't have a cell wall.
Okay, it basically lacks the rigid cell wall. Okay, it's a bacterium that lacks a rigid cell wall. Now we are going to look at that cell wall. When we study this part of the pharmacology, when we are dealing with the beta-lactam antibiotics, it is that particular cell wall that we are dealing with. And then you will realize that when you are treating the normal host who has community-acquired pneumonia, the suspected causes are these two, okay? Mycoplasma pneumoniae and Streptococcus pneumoniae. Now, this one, strep pneumoniae, has the usual cell wall. It's a gram-positive organism. It has the peptidoglycan structure. While Mycoplasma might have peptidoglycan structure, but very limited in terms of amount, and therefore the cell wall is not rigid enough, and it is not critical for the survival of the organism, okay? Now, when you look at the pediatric patient, okay, pediatric patient, you're going to find something different. We have Streptococcus pneumoniae, which is a gram-positive organism, and Haemophilus influenzae, which is a gram-negative rod. Now, that means that when treating pneumonia in the normal host, okay, it's different in terms of empiric treatment, which drugs to choose is different from when you are dealing with a pediatric patient. Now, this is what, when I give you your test, it will have the pharmacological effect, which site of action, mechanism of action, but it is also going to go into treating patients with a pediatric patient with pneumonia. Which drug of the following, or which class of drugs are you not going to select if you're looking for the treatment of this disease? So there are differences based on the organisms. Now I'm going to leave you with this slide. You're going to have to study these tables and be familiar with the organisms causing which condition, so that it will be easy for you to select the antibiotic with logic when you're using empiric treatment, when you're using empiric treatment. Okay, I'll now proceed. Now, the structural integrity of these penicillins is critical. Okay, so the 6-amino penicillinic acid nucleus is essential for biologic activity of the penicillins. Now, hydrolysis of the beta-lactam ring by the beta-lactamases, which are also referred to as penicillinases, yields penicilloic acid, which lacks bacterial activity. Now, that is important. So structural activity is critical. Now, Some penicillins are resistant to beta-lactamases. That is also important to remember. And then the substituents R can be attached to the secondary amino group, and they determine the essential pharmacologic and antibacterial properties of the resulting molecule. Okay, so what we have done now is we said, okay, there are some penicillins that are resistant to beta-lactamases. And then we said that the structural integrity of these beta-lactam antibiotics is critical for them to have antibacterial effects. Okay, but now we look at the groups, the subgroups of penicillins. Now, the first group we look at here is what we refer to as penicillins. Okay, and we will see the types of drugs. Now, these stars that I have included here will show you on the next slides which drugs you're dealing with and be able to classify the drugs. I'll show it to you now. For example, for penicillin G, it is a penicillin. While the anti-staphylococcal penicillins, we have these ones which have the purple star, and then the extended spectrum penicillins are the ones which have this sunflower structure. Okay. All right. Okay, so we'll just go through the penicillins. Now, the penicillins, they have activity against gram-positive organisms, okay, gram-negative cocci, and non-beta-lactamase producing anaerobes. Now, I think this should bring to you the reasons clearly why I started by giving you the table that classifies the organisms, because you have to remember these organisms. If I tell you penicillins work on gram-positive organisms, now you have to know the gram-positive organisms. And then on gram-negative cocci, then you should know the gram-negative cocci. And then the non-beta-lactamase producing anaerobes. So when we go to the anaerobic organisms, they are meant to work against several of them as long as they are not beta-lactamase producing, okay? And then it is important to note that they have little activity against gram-negative rods. So when we talk about Escherichia coli, Campylobacter, Enterobacter, Shigella, Salmonella, Klebsiella pneumoniae, Proteus mirabilis, Proteus vulgaris. If you talk about those types of organisms, then you would say, no, these drugs are unlikely to work against these organisms. Now, the reason why I gave you the tables is that when I give you a condition and I say a patient has come to the facility and then is complaining of say, urinary tract infection pain, and then I ask you which of the following drugs are you going to select, or which of the following organisms could be the cause, or pair the organism and the drug that should work. That kind of information, you're going to have good memory to remember the organisms and which conditions they cause and which drugs are supposed to work on them. That is why the antibiotics are easily misused, because to try and connect these things and remember them is not always easy. But for now, with your fresh brains, I'm sure it will be a lot easier for you. Okay, so penicillins have little activity against gram-negative rods. Now, the anti-staphylococcal penicillins, this group of drugs, which are anti-staphylococcal, of course, by their name, you know that these work against staphylococci, but they do work against streptococci as well. But they do not work against these gram-positive cocci, the enterococci. Those ones, you can't use the anti-staphylococcal penicillins. That is where they remain stuck on their staphylococci. And then we will find out why they are active against staphylococci and why it is important to know which condition you're dealing with and to know the drugs that could work against the particular organisms. Okay, these drugs do not work against anaerobic bacteria. They don't work against gram-negative cocci, and they don't work against gram-negative rods. No effect whatsoever. So they are limited in terms of spectrum. They are narrow spectrum. They can work against staphylococci and they can work against streptococci. Okay. They are resistant. Now, remember, I told you about beta-lactamases. Now, beta-lactamases are enzymes that are produced by bacteria. Different bacteria do produce beta-lactamases. And the beta-lactamases differ. It's a group of enzymes which break down the beta-lactam structure. Now, these drugs are resistant to staphylococcal beta-lactamases. So that's why they are called anti-staphylococcal penicillins. However much the penicillins produce beta-lactamases, these drugs, the staphylococci, these anti-staphylococcal penicillins will still work against them. While the other penicillins, including the extended spectrum penicillins, will not be able to treat staphylococcal infections where the staphylococci are producing these beta-lactamases. These penicillins will not work. Penicillin G will not work. These penicillins, where you have amoxicillin, ampicillin, carbapenicillin, meslocillin, piperacillin, and the others, they all won't work. But the anti-staphylococcal penicillins, which we will see, they have a particular way they sound and they're easy to remember: oxacillin, cloxacillin, dicloxacillin, flucloxacillin, and then one unique one, nafcillin, and maybe phenoxymethylpenicillin. These ones will work against the staphylococcus infections. Okay? That is one point that you need to remember. Okay, and then we have the extended spectrum penicillins. Now, these ones, like the penicillins, like these penicillins here, where we have penicillin G, like the penicillins inactivity, that means they work against gram-positive organisms. They work against gram-negative cocci. They have improved activity against gram-negative organisms, okay? And they also work against the anaerobic organisms, just like these penicillins. But here you have added the gram-negative organisms. So in terms of selection, these drugs seem to be better, okay? These ones. However, there are times when these ones are preferred. And as time goes by, you will be able to identify the diseases and conditions where the penicillins are preferred over the extended spectrum penicillins. Any questions? No questions. All right. So what we are going to do, I'll just proceed. I'll finish in a few minutes. Okay, so these are the drugs. Now, again, when you come to this table and you're looking at the organisms, you can always refer to this table, because when you understand this table, then this slide, then this table also makes sense to you easily. So you can see here under the anti-staphylococcal penicillins, indicated only for non-methicillin resistant strains. We will talk about methicillin resistance a bit later. Staphylococcus aureus, Staphylococcus epidermidis. Compared to other penicillins, these penicillins are resistant. These penicillinase resistant penicillins lack activity against Listeria monocytogenes and Enterococcus species. Okay, so then they are narrow, their spectrum is narrow. They are basically targeted for the treatment of staphylococcal infections. And now when you come to penicillin G, that's where you get benzyl penicillin G and procaine penicillin G. You're going to find these organisms, and you will see Listeria, okay? Then Neisseria meningitidis. These are Listeria meningitidis is gram negative coccus, while Listeria is a gram positive rod, if I remember correctly. And then they're effective against many anaerobes, where you have Clostridia difficile, Clostridia tetani, and Clostridium perfringens. This penicillin is preferred. And I said, while the extended spectrum penicillins are more, they're extended their effect against gram negative rods, but you will find that there are conditions in which the penicillin G is preferred. And so when you deal with Clostridium infections like perfringens and tetani, then you're going to, I think, better use penicillin G. It's also effective against spirochetes and actinomyces and the other drugs, okay? Other organisms. Okay, so I won't go through this table. You can always read through and refer back to the notes on the slide that introduced you to these drugs. Okay. Now I'm going to talk about the cell wall, and then tell you about methicillin resistance, and I will close this particular lecture. Now remember that the gram-positive organisms differ from the gram-negative because of this. They have a thick peptidoglycan structure. Now, their beta-lactamases do appear there, okay? While beneath the peptidoglycan structure or peptidoglycan layer, we do have this lipid bilayer, the plasma membrane, okay? And on this plasma membrane is where we do find the penicillin binding protein. Now, this penicillin binding protein, which is also, of course, available on the gram-negative organisms, is the one responsible for the synthesis of the peptidoglycan layer. Now, for the gram-negatives, you do have another bilayer outside, which is difficult to penetrate to reach this site. But the beta-lactamases are found between the two lipid bilayers. And the drugs normally pass through these pores, the porine structures. They pass through there to gain access to this penicillin binding protein. So when we give drugs, these are beta-lactam antibiotics, our target is one. Our target is one. It is the penicillin binding protein. Remember that the integrity of these organisms is based on their cell wall. If the cell wall is not there, these organisms are going to run out of structure. They will burst open and they will live no longer. So they need the peptidoglycan structure. Now, when we inhibit the synthesis of this peptidoglycan structure, then will render the organism susceptible to destruction and the organism dies. So the penicillins and the other beta-lactam antibiotics are bactericidal in property. They are bactericidal. They kill these organisms. So the target of these drugs is the penicillin binding protein. Okay. So that means that for these drugs to fail to work, they will either fail to reach the penicillin binding protein, or when they reach it, their site of action has changed. Two things. They either fail to reach the penicillin binding protein, or the site has changed. The site of the penicillin binding protein where the drugs are supposed to attach has changed. And therefore, that change is normally a mutation. When it has mutated, then the penicillins and other beta-lactam antibiotics will hardly work. The other way resistance can occur is if the drug manages to reach, but then it is picked up by a pump and pumped out. That is another way resistance could occur. The other one is the beta-lactamases. So these ones which the drug can reach, but the beta-lactamases are hyperactive, and they come and break the beta-lactam ring and render the drug ineffective. So that's how resistance generally occurs. Let me finish by talking about this beta-lactam. You can read what is provided in these slides. I'll give you the slides themselves. But this is what is happening. The peptidoglycan structure. This penicillin binding protein is also called transpeptidase. Okay. Now, this is how it works. You see these building blocks. We have a glycopeptide polymer made up of muramic acid and N-acetyl glucosamine. I need to get that name right. N-acetyl glucosamine and N-acetyl muramic acid. These are the ones that are the building blocks. Okay. Now, at the end of that glycopeptide polymer is this pentapeptide, and which is made up of these amino acids. We don't have to remember them really, but this just gives you the types of amino acids there, and also because the mechanism of action does apply for this particular enzyme. Okay, and then attached to another pentapeptide made up of glycine. Now, how this enzyme works, the transpeptidase, which is the penicillin binding protein, it cleaves off the D-alanine at the end of the pentapeptide, and then fosters its attachment to this glycine pentapeptide. And so this is the result. And so this process goes on and on and on and on and on, and then you're going to have this peptidoglycan structure. So what you see here, therefore, right here, okay, is these represent the glycopeptide polymer, and then the attachments are those pentapeptides, okay, which are fostered by this penicillin binding protein, the transpeptidase. Any questions? None. Okay. Okay. So when you have resistance developing because of transpeptidase, the change in structure, then the penicillins won't work, monobactams won't work, cephalosporins won't work, Carbapenemases also will not work. There is one, the carbapenems also won't work. There is one drug among the cephalosporins, which is a 5th generation cephalosporin, which is believed to have effect against the methicillin resistance. Let me finish by saying that methicillin resistance is different from beta-lactamase based resistance. Beta-lactamases break down the beta-lactam ring. That type of resistance is opposed by giving the beta-lactamase inhibitors. So the penicillin is still able to work. Just inhibit the beta-lactamase enzyme so that it will not break down the beta-lactam ring. But methicillin resistance is when you have a change in the structure of the penicillin binding protein, the transpeptidase enzyme that is responsible for the synthesis of the peptidoglycan structure or layer. Because it has changed, no penicillin is going to work, and there is no way you are going to sort out that problem, which makes methicillin resistance a very difficult type of resistance. Now, they call it methicillin resistance because in the labs, they use this particular drug. Where is it? Methicillin, okay? They use methicillin. And so if a sample is taken to the lab, they want to test resistance. Why is the patient not responding? Or for labs that are able to test just before treatment, they will just test. And then methicillin, and they will be doing this test against gram-positive organisms because they're the ones where you find methicillin resistance. And so when this drug in the lab fails to inhibit growth of the organism, in other words, in the presence of this drug, the organism multiplies, then that means that there is methicillin resistance. Now remember, methicillin is an anti-staphylococcal penicillin. If you have methicillin resistance, that means that this organism could be producing beta-lactamases, but methicillin, being an anti-staphylococcal penicillin, is insensitive to these beta-lactamases. And so it is supposed to work against the organism. But if the organism continues to grow in the presence of methicillin, then that means what you have is methicillin resistance. And this is found in staphylococcal organisms, staphylococci. And so that type of resistance is what we call methicillin resistant, the organisms, methicillin resistant Staphylococcus aureus, MRSA. Those are very difficult organisms to treat. Now, the reason why they're difficult to treat is not only that many antibiotics, the beta-lactam antibiotics, are not going to work, but also they do have other resistance mechanisms that have developed, so that many other antibiotics also fail to work against them. So methicillin resistance is not only dangerous because the beta-lactam antibiotics won't work, but many antibiotics are not going to be able to work against the organisms. Ladies and gentlemen, I will close the lecture for now, and then I will proceed when we meet next, so I can close the loop on these beta-lactam antibiotics. Okay? Any questions?